Welcome to the Mind Body Bowen Podcast, a show that explores mental health, physical health, and self-help topics with experts in their field. Designed to inform, inspire, educate, and help you live your best life for longer. There's no doubt about it. Proactive health screenings save lives. Many serious diseases, if found early, can be mitigated and sometimes out-and-out cured thanks to proactive health screenings. In this episode of Mind Body Bowen, Bowen Health Director of Nursing, Nurse Practitioner Kim Richard sits down with Dr. Siquilla Liebetrau to talk about women's health screenings and help understand just why they are so very important.
Kim, welcome. I am so excited to chat with you today. We are talking about a very important topic of women's health. Women's health, super important. Yes. Okay, so let's jump right in. When we talk about preventative health screenings, they are incredibly important. One of them is cervical cancer screening. What are the recommendations? It's really hard to just keep up.
It is hard to keep up. And in preparing for this podcast with you today and my research, just like many women do, how often do I need to get this done? There's a lot of different guidance out there and a lot of different guidelines. So when I talk today about guidance...
I'm glad to hear it's not confusing just to me.
No, it's not confusing. It's confusing for a lot of people. A lot of different guidelines out there. When we talk guidelines, I mean places like the American Cancer Society or the American College of Gynecology. So when I speak of recommendations today, I'm going to take my recommendations from an organization called the United States Preventative Task Force. And that is an organization that takes guidelines from many organizations and kind of rolls them into one for what's best practice.
Good to know.
Yeah. So best practice for cervical cancer screenings, the recommendation from the United States Preventative Task Force is we start screening women at age 21.
Okay.
So from age 21 to 25 years old, they should have their first cervical cancer screening. And then if those results are normal, the recommendation is every 3 years up until the age of 30. And after that, every 5 years, which is much different than when we were younger, where it was once a year. So that's good news. We don't have to go back as frequently, as long as we're getting regular screenings and all of the testing is normal.
Okay. So that brings me to my second question. Sometimes you may get a result that says abnormal. That can sound very scary. What does that mean, and what kind of comes next?
So abnormal screenings are very scary. The important thing to know about abnormal screenings is it just means that it's abnormal. We need more information. So you would be asked to come back into the office for further screening or further testing. When we take the cells from the cervix to send that to the lab for cervical cancer screening, we're screening for cancer cells, but also sometimes they can identify cells that are just called abnormal dysplasia cells. And some people might refer to those as precancerous. Sometimes testing...
Which is another scary term, right?
It is a scary term. That C word can be very scary. There's another part of testing called co-testing that we start doing after women turn age 30. And that's where we're also screening for HPV, which is a virus that has a couple of strains that have been linked to cervical cancer. So just because you may have a positive HPV or some positive dysplasia cells, it doesn't mean that you have cervical cancer. It just means we need to look a little closer, stage what that might be, and make a plan for what's next. And that could be anything from having those abnormal cells removed or just follow-up testing more frequently.
Okay. I love that. As much as this sort of starts as a scary conversation, what I'm hearing you say is we can catch things, we can make sure that you're healthy and that you're safe. And as long as you follow these guidelines, that's really the important piece. We can prevent the big C.
That's what's most reassuring, is that if we can identify these things, these big C cancer cells early, we have more of a chance of better outcomes with treatment.
Good. Okay, so then the next really big one, breast cancer screening. Tell me what the guidelines say about that.
And same kind of scenario. I think in my notes I wrote down a lot of different ages, and things can be very confusing. Mammograms generally start at the age of 40, and the mammogram is the actual test that you get done in a radiology department where they're taking X-ray images of the breast tissue. There's some differing opinions on whether or not mammograms should be done every 1 year or every 2 years. Personally, I do my mammograms once a year, but every 2 years is what the United States Preventative Task Force recommends, and that would be for a woman with no family history of any breast cancer and with normal density breasts.
Okay. So if you want to take a little bit more of a conservative approach, it sounds like once a year. If you feel you're pretty healthy overall, no family history, once every other year should be fine.
That's correct.
Okay.
That's correct.
But there's definitely that family history piece. As a provider, what are some things you're listening for that you would want your patient to tell you about?
Yeah, definitely. If there's a family history from your mother, grandmother, sisters that have had breast cancer, or if they have tested positive for the BRCA gene, which is the genetic testing that some women can have done that tells us that they may be more susceptible to getting breast cancer, we would want to screen those women much earlier. There are some women, too, who have their first mammogram and it comes back and says this breast tissue is very dense. We can't really see very well. And so they might recommend annual screenings for these women.
Okay, fantastic. And kind of same thing. If something comes back in the screening, what's sort of the next step?
Yeah, great question. Next steps for that is an ultrasound or an MRI of the breast, depending on what is found. We have a lot of areas in our breasts that could be cysts or nodules or things that are considered benign or not cancerous. And we can't always tell the difference just on a regular mammogram screening what that is. So it's important when we see something, it doesn't mean that it's terrible. It just means we need to know what it is for sure so we can continue to watch it with the regular routine screenings.
Okay. Don't freak out.
Right.
Just do what the doctor says.
That's right.
Okay. So next, there are a couple of different screeners that you recommend that happen more frequently. Let's talk through those. What are the ones that you would like to get, would like every woman to get sort of, I think, every time you see them?
Yeah, every woman, every time we see them, we think about the physical health things, the cancer screenings, the cervical cancer, the breast cancer. We also want to talk about health as far as physical health, as far as your diet, nutrition, physical activity, and that pertains to preventing other illnesses like high blood pressure and diabetes. But we also want to make sure that we're screening for other things that could be going on with women, such as mental health problems, depression, anxiety, stress, coping skills, intimate partner violence is a big one.
Sexually transmitted infections.
That's true.
One,
that does go with the physical health part. Yes. Yeah. Thank you for reminding me of that. Certainly, we want to ensure that everyone has an opportunity to have screenings for sexually transmitted diseases, especially if we're having multiple partners or maybe we're concerned that our partner had some infidelity. With or without symptoms, it doesn't matter. Screening is always okay.
And I love that you have this list of screenings because I think these are all things that there are treatment options for. Why suffer if you don't have to? There's lots of treatment opportunity available for things like depression and anxiety, whether it be therapeutic, medication management, maybe both. We know that things like tobacco use and obesity are both linked to lots of other health conditions. And so if we could be focused in supporting those areas, and I think too, it's important for us to say, we're not here to shame you. We're not going to shame you if you smoke, or we're not going to shame you if you have a few pounds to lose. The whole point really is this is impacting your health, and we want to be here for you, right?
Right. One thing that I tell patients when I see in my office quite often is if I'm addressing smoking or weight loss, either one of those two actually, is that I want people to know that I'm here for them when they're ready to make those changes in their life. I know that the warning is right there on a pack of cigarettes or, on a vape. We know what the warnings are and what the risks are as it pertains to what they're doing. I want people to know that I truly care about them and their health, not just today, but what their future is.
Absolutely.
So some people aren't ready to round that corner. Some people will say, I've really been thinking about it. That kind of gives me an opportunity to ask them more questions about, well, what have you been thinking about? Do you know what options there are to maybe quit smoking or to help you lose weight? Let's talk through some of those. Maybe there's some things that I can help with.
Absolutely. Because I think sometimes when you're walking around with kind of a problem in your head, like, oh my gosh, I need to lose weight. I've tried this. I've tried everything. Nothing's going to work. You sort of kind of go around in the same circle over and over. Yeah. Whereas when you're talking with your provider about it, they can step outside of it a little bit. They're more objective. They potentially have more resources than you do. And so just having that conversation out loud and talking about the fact that there's options, there's timelines, you don't have to achieve it all at once. We can be your support system. That's the other really, really important thing with these big kind of overwhelming goals. Doing it on your own is hard, but if you have a provider that can support you along the way, so much easier. Not easy, but easier.
That's right.
Absolutely.
Yeah.
So then there are a couple of other things. I love these. You and I talked a little bit about what are some of the things that your patients come to you and ask you about.
Super common questions that I get. And I was actually thinking of one of those as we started talking about weight loss, weight gain as it pertains to women's health. And that does kind of come up on maybe the second question there that I wrote down that I get from women a lot.
Yes. So let's jump in since that's where you want to go. Yeah. Hormones and talking about menopause or perimenopause. Am I in it? What is it? What does it mean? What are the symptoms?
Yes.
How can you help me?
Help me, please. Yes. Goodness. Gone are the days that women have to white knuckle menopause. We don't have to do that anymore. No.
And the guidance has changed so much.
The guidance has changed a lot. Yes. Yeah. So when I hear a woman who is telling me I'm having trouble losing weight, I'm eating right, I'm exercising, I'm doing all of these things, the first thing I do is I think, how old is this person?
Yeah. Because that's important information.
It is. If we are in the age group of menopause or perimenopause, which is on average 45 to 55 years old, my mind goes right to there. Some women can start in perimenopause as early as 35 years old. So
I just learned that more recently. And that was kind of shocking, but that really makes a lot of sense when you start talking to women.
It does. Yeah. Our hormones really start to change. And then throw into the mix things like hysterectomies, where maybe I don't have a uterus, but I still have ovaries. So I still have the hormones that are coming from the ovaries, but my uterus is not giving me a monthly cycle. So have I been 12 months without menses? That's what we clinically define as menopausal. So how do I know? The answer is we don't. There's no real way to know. There is hormone testing that we can do. I can run a panel of expensive labs and check your estrogen and your progesterone and your luteinizing hormone. And there's a lot of hormones that we can check. And there are a lot of clinicians out there that check hormones, and they're very, very thorough and very good at reading them and understanding them. But without a real good idea of what day a woman is on her monthly cycle, those hormones naturally fluctuate. So it does become a little messy.
Okay.
We can take a woman's symptoms that she's telling us that she's having,
along with the age, right?
Along with that average age group. And if you're telling me, gosh, Kim, I'm having hot flashes, I'm waking up in the middle of the night, I have to change my pajamas, my hair is thinning, and have a very decreased libido, and you're having all of these symptoms, there's no reason why we can't just talk about what hormone replacement might look like and if that would be an appropriate option for you.
Fantastic. I love it. There's help. So there's one other thing that you mentioned that your patients ask you about often: irregular or painful menses.
That happens a lot too.
Yeah.
Same thing. I turn right to, gosh, how old is this person? What are we dealing with here?
Yeah.
Older women, we may be going into a menopausal state, or do I need to look at early menopause? If this is a woman who is beyond menopause and that's a serious problem that needs to be evaluated right away. Younger women may not always have regular monthly cycles. So kind of getting into that of what is regular for you, what are the changes, how are you feeling, it's a very broad differential, and we don't want to miss anything.
Absolutely. Gosh, we can talk about these things all day. I would say one more thing that your patients come to you all the time talking about, and that's infertility.
Yeah. Infertility. I have a couple people on my mind right now, and one of them actually is expecting finally, which is such great news. So there's hope.
Yes.
And some of the older guidance out there, they want couples to try to conceive using, no protection for at least 12 months. That's a really long time for a couple to wait month after month and negative pregnancy test after negative pregnancy test for 12 months, then to consider, gosh, are we infertile? And there's some new guidance out there, and I agree with this. I don't think people should wait 12 months to come in and talk to somebody. If it's been 6 or 7 months, come talk to somebody. Let your provider know that you've been trying to conceive. There are a lot of things that could cause your ovaries maybe not to want to release an egg, things that are very easily treated. Let's do some labs. Maybe we have an underlying thyroid disorder or some insulin resistance, which is a type of early diabetes that we can check for. We can treat that really easily. And some women, after appropriate treatment, getting those things balanced, can become pregnant within a couple of months.
I just keep hearing you say over and over and over, talk to your provider.
Just talk to your provider.
Any of these things, if there's any scary questions, if there's anything that doesn't make sense, if your body is telling you something is up, just talk to your provider.
Yep. That's why I wanted to talk about this topic so much today, because women don't have to be suppressed anymore with their health. We have a voice. We can talk about our bodies. We can talk about our cervix. We can talk about our breast health. And we can talk about periods and cramps and things not going right.
And we can get help.
And we can get help for it.
Yeah, I love it. Thank you so much.
Thank you.
Thanks for joining us. You can subscribe to Mind Body Bowen Podcast wherever you get your podcasts. A new one drops every other Friday. Next time, Bowen Health clinical educator Holly Hershey-Hurd talks about mindfulness. Visit bowenhealth.org to learn more about Bowen Health. There you can visit our educational resources section to learn more about our podcast and to read our blog. Mind Body Bowen Podcast is a production of Bowen Health.